Good morning, everybody. I'm Andrew Salciunas with 97.5 The Fanatic. You can catch me every day, Monday through Friday, 10 to 2 with my man, Anthony Gargano. And I absolutely love doing these. It's always a treat for me. Another incredible opportunity to talk to another incredible person from the team at Virtua Health. And today I'm joined by Dr. Angela Skrzynski. And we are going to be talking about primary care and how much things have changed. I mean, the world, we're on a Zoom call right now. So that alone is an example of how much things have changed. It's not just the same as just going to the doctors and saying, hey, I have something going on. Now we can just do everything virtually, which is why we're talking to Dr. Angela Skrzynski today. Doctor, how are you? Good morning.
I'm good. Thanks. Thanks for having me. Good morning.
Oh, thank you so much. I absolutely love doing these. I talk about it all the time. I learn so much all the time when I speak to the incredible team at Virtua Health. So I'm glad to be talking to you today because this is something that's impacted my life, but everybody's life throughout the world, really, not just the country. And so let me ask you, how much since COVID has taken over this world, how much has COVID impacted the way that primary care is practiced?
It's been pretty phenomenal, not just primary care, but healthcare delivery in general. Of course, the clinical medicine hasn't changed. What we actually do for people as physicians is no different. But the delivery system is completely altered. I think it's very rare in history that something happens globally that really accelerates adoption of something new. And so we've seen something really unique happen here in the past few years where the COVID-19 pandemic has significantly accelerated the adoption of digital health. And that was really driven by our patients who were saying, I don't want to come in and be exposed to germs. And once they started to get to know telemedicine, it was kind of like, this is pretty cool. This is convenient. This is accessible. And so, of course, as there's been more demand, we've also increased our supply. So I'm sure that you know that most healthcare systems now, most clinicians offer some form of digital health. And there are even, some of the bigger names in the industry who are offering telemedicine. And so it's really changing the landscape of healthcare.
Now, what is one of the main differences? Now, obviously, the main difference is being in the office versus just being right here in my house and communicating with you over the computer. But other than that, what are some of the main differences between telemedicine visits and in-person visits?
Yeah. So, when your traditional in-person visit, you're going to get in your car, drive to the office, sit in a waiting room until the clinician is ready to see you. And then you're going to be brought back to an examination room. The clinician is going to be able to lay hands on you and examine you in that way. Whereas in telemedicine, you are going to, like you said, you can access it from the comfort of your home or even anywhere else most of the time that you can get a good signal and that you're able to sort of have some privacy and show whatever parts of the body that you need to show. And it's a much more accessible experience, particularly for those of us who have mobility or transportation barriers. This can be really great because the vast majority of folks at this point are going to have a smartphone and some access either to data or Wi-Fi. And so, that's really all the tools that you need to access care now. And you can do this with a lot more flexibility. So, this can be on demand. Hey, I need to see somebody right now. You log in, Virtua has an urgent care telehealth service, for instance. You log in from a web browser and boom, you have an appointment that day, to see somebody and get evaluated. So I think telemedicine really changes the way that we're able to access care and the convenience and the safety with which you're able to access care because you're no longer sitting in that physical waiting room surrounded by other sick people. And the experience of telemedicine is going to vary from clinician to clinician. While you're waiting for a clinician here at Virtua, for instance, you're either going to be told, hey, go about your business, do whatever it is that you need to do, including, you need to go run and get some gas, you need to take care of your grandkids, whatever the case may be. And then for some of our other virtual visits, we put you in a lounge while you're waiting to see the clinician. That 5-10 minutes that hopefully passes by a little quicker because we're able to present to you some video content that hopefully piques your interest and makes you feel a little bit more comfortable during that wait rather than, kind of scrolling on your phone, which of course you can do that too. Right. So it's just a lot more convenient. And then, the difference, of course, is that there are some limitations in terms of the physical examination. So of course, if the clinician is seeing you via telemedicine, unless you have some specialized devices at home, they're not going to be able to, for instance, take a listen to your lungs, take a peek in your ears. And so, those things are different in telemedicine. You'd be surprised, though, at how thorough of a physical examination really can be done digitally. So it's really kind of beneath to see what the capabilities of digital health are.
So I'm glad that you brought all that up at the end there, because obviously a lot of the times we go to the doctors when we're feeling sick. We should go to doctors all the time to get checked up. But most of the time, I feel like my throat hurts, I'm going to do this telehealth visit. Now,
Sure.
how should we prepare for our primary care telehealth visits? Because like you just said, there are limitations. So what should I do as the patient to try to get the most out of my appointment?
I think it's such an important question that you bring up, Andrew, because for so many of us, clinicians and patients alike, telemedicine is rather new.
Mhm.
And so we sort of know what we need to do before we go to the doctor's office. But how do we best situate ourselves to have a really successful telemedicine visit? And I think the number one thing that you want to do in advance of your visit is just to know how to get into the visit and who to contact if you're having any technical difficulties. And then, give yourself that extra little bit of time. So you'll be asked to come into the office 15 minutes early. Same thing in telemedicine, go ahead and get situated and get onto that visit about 15 minutes early. That way, if you do run into any issues, you can call that office phone number or, whatever the contact is at Virtua. You either call somebody or you can even do a virtual chat and say, hey, I need some help. And someone's at the ready to assist you. So knowing who to get in touch with, getting in early can be really, really beneficial. And then, it's also really helpful to have any like medications or devices at your fingertips. So if the clinician asks, what's that blood pressure medication that you're taking? Or what do you happen to be able to take your blood pressure for me right now? Or even your blood glucose or a pulse oximeter, any of those things that you have, bring them with you to your, at your fingertips for your visit so that they're available if needed. And, I think that really helps to set you up for a really successful visit.
Now, other than just prior to my visit, obviously you mentioned technical difficulties, right? Here I am on screen right now. Does it look nice for you? Like,
It looks great. You've got good lighting. You're centered in the screen.
Okay, that's good. All right.
Yeah.
So let me ask you, during the actual telehealth visit, how should I, as the patient, act? Obviously, I shouldn't mute my screen where you can't see me. Obviously, I shouldn't mute my mic so you can't hear me, but all kinds of other stuff. I imagine, like you said, you want to have everything prepared. You don't want me walking off camera. Oh, let me go get my paperwork. So what should I do during the actual visit to make it easier for you, the doctor?
Yeah, no. So you can go off camera and go walk around and get your medications if you forgot to bring them. I mean, that's really one of the beautiful things about telemedicine is that flexibility of being at home and being able to access all those things. But, during the visit, making sure that the clinician, if you're using a video component, making sure that you're easily able to be seen, which is going to include lighting and also your position in the camera. And making sure that you can show the clinician whatever area of the body that you're referencing. So for instance, if I have foot pain, I want to be able to roll back my chair and lift up my foot or bring my phone down so that you can see my foot, because almost certainly the clinician is going to want to examine the area of interest. And then making sure also that you're dressed appropriately for the visit. Now, you're at home, and so pajamas are totally acceptable for these types of visits. But we will have patients, believe it or not, who will come, shirtless, or they'll be in a position. We've had patients come in on the toilet in a telemedicine video visit. These are the types of things that you want to probably be a little bit mindful about the comfort of the clinician in these situations, and just having that little bit of professionalism that you usually would bring to the office with you. But again, there is that leeway of being able to be in your pajamas and your slippers and even in your bed when you're not feeling well. So, you still have all of that, but then just making sure that you temper it a little bit.
I hope everybody took note there. Be a little bit more professional during the visit, but like you said, you can also still be comfortable, which is fantastic. Now, finally, the post-visit process. If I come to the doctor's office, I see somebody at the front desk,
Right.
My next appointment is scheduled, or I know where to go to get my medicine if you are saying that I need to take some sort of antibiotics or something like that. So let me ask you, what is the post-visit process like after I'm done speaking with the doctor?
As you referenced, Andrew, the most important thing at the end of the visit is to make sure that you know what your next steps are. So, who do I need to see? When do I need to come back? And how do I initiate all of that care? How do I schedule the follow-up visit with you? How do I schedule those labs that you want me to have done, et cetera? And who do I contact, again, if I have any difficulties? In most cases, when you're in the office, they're going to hand you an after visit summary or some sort of after your visit note that sort of goes through what your next steps are going to be. And here at Virtua, we utilize an online patient portal called MyChart. Our patients love it because you have immediate at your fingertips access to your lab results, your imaging studies, your office visit notes, your upcoming appointments, all your doctors' names, and these after visit summaries. So at the end of a telemedicine visit, instead of us handing you a piece of paper, you'll get a notification that says, hey, your after visit summary is ready on your cell phone. And you'll be able to click the link, open up your MyChart account, and boom, there it is. And it's there for you wherever you are. You don't have to bring a paper around to the grocery store with you when you're going to fill your prescription. It's like, oh, here it is. She wanted me to get this medication. And so making sure that you know where to find all that follow-up information is going to be really important.
Now, Doc, a lot of the questions I've asked you about today have been about me, the patient, right? And how to make my life easier. But let me ask you, from your point of view, how have you and Virtua utilized telehealth visits for primary care? What have you guys done that have been different or the same as to a regular in-person visit?
Here at Virtua, we've really adapted to what it is that our patients are looking for. And we're learning that more and more patients want convenience, they want accessibility. Life is so busy. You're running around to work and maybe you have a family or you have friends and all these social commitments. And it can be really much easier to access a visit on your lunch hour at work than it can be to, have to take time off and drive into an office. And so we've really wanted to meet our patients' needs in that way. So all of our 26 primary care practices do offer telemedicine visits. And about 2 months ago, we opened up a new practice that we're just incredibly excited about. It's our Virtua Primary Care Telehealth practice, and it offers most visits in telemedicine. So while all of our clinicians offer telemedicine, this practice is actually built around providing digital health to our patients. So almost all of our visits are going to be done via telemedicine in a video format, just like this. And then when we need to bring patients into the office, either because they need their annual wellness exam or because, as I mentioned, we need some of those limitations of telemedicine met, like listening to lungs, looking, and ears, we bring them into our Voorhees office location. And we've got some really, really experienced physicians and staff who know telemedicine backwards and forwards and can really walk patients through the process of utilizing telemedicine, which I think is just so important to the experience. And it's also the practice where we're extremely digitally forward. So any of the new technology that Virtua is utilizing or piloting, we offer to these patients first. So they're always going to have access to the latest and greatest here at Virtua because we know that they're the exact patients who are looking for that type of experience.
This is why I love doing these, because I've learned so much today. Dr. Angela Skrzynski, you were fantastic. And thank you so much for talking to me because, again, I'm lucky. I get to learn so much speaking to the entire team at Virtua. And I want to say, for more information on telehealth visits, make sure you visit virtua.org/PC telehealth. That's PC telehealth to get more information on the telehealth visits, because like you said, it's kind of new to you and the team, but it's also new to a lot of people, right? Like I'm sure there are a lot of people that are still confused with actually doing the telehealth visit as the patient. So again, visit virtua.org/PC telehealth. Dr. Skrzynski, I really appreciate it. Thank you so much for joining me today.
Thank you so much, Andrew.